Congenital heart defects can affect any baby, meaning an abnormality in the way their heart or vasculature or blood vessels formed. Many of those children require surgery for repair of their heart or their blood vessels. About 1% of the population can be born with a congenital heart defect. Cardiac catheterization and interventional cardiology has really allowed us to treat children without the invasiveness of an open heart surgery. There's no incision, there's a much shorter hospital stay. Patients for many procedures go home the same day or the day after the procedure. There's no need for an intensive care unit for most of these procedures. There are a variety of heart defects that can be treated in the cardiac catheterization laboratory. Those defects include things like atrial septal defects, which is a hole in the wall between the top two chambers of the heart. It includes defects of the major blood vessels in the body, the aorta in particular, with a defect called coarctation of the aorta. In the cardiac catheterization laboratory, procedures are generally performed with anesthesia, especially for young children. So they're asleep during the procedure just like they would be for an operation. That makes these procedures painless and takes away a lot of the anxiety related to the procedure. We don't need to make large incisions to put catheters in. We make a tiny little nick in the skin. The catheters are placed into blood vessels, and once those catheters are in those blood vessels, we can manipulate them through the body and up to the heart. And once we're done with the procedure, the catheters all come out, and the area where they went in is simply closed with a Band-Aid and heals on its own. Our congenital heart team in the cath lab recently took care of a young girl who required a new valve to be placed. We were able to place that valve and have her go home the next day, and her parents called me to tell me that the next week she was back in dance class and doing wonderfully. I'm Dr. Jeremy Asnes. I direct the Congenital Cardiac Catheterization Laboratory here at Yale Medicine.